I'm proud to be a healthcare provider, not a sick care provider. And, we need to start putting the passion back into knowing that we help people. And I think you become more passionate when you actually help people make changes. Like when people see the change in their InBody, that's not something they did with drugs, right? That's something they did with hard work. And people become really proud of that. And when your patients are proud and your patients are getting amazing results, you form a relationship with them. They look at you as somebody who has really made a difference in their life. And that's a really special thing when somebody has that relationship with you. I have so many of my patients. I tell my wife all the time, my wife runs my practice, but I'm like, Joe, we have so many awesome patients, and I love going to my practice. Doesn't mean that it's not hard work. It's hard work, right? But I love going through the door in my office. It makes me feel good that I'm doing something for somebody else and they pay me for it. And I've developed these great relationships, and it's all based on getting results, right? And it's great to have a great relationship. But when you have a great relationship and you get great results with your patients that you can document, it takes it to a whole another level.
Welcome to Beyond the Scale. I'm your host, Bradley Davie. This podcast exists to educate and empower the next generation of healthcare providers. We're here to share tips, tricks, tools, and resources to help catalyze your growth with InBody's ecosystem of health assessment tools. Today, we're going to talk about how body composition is applied in wellness-driven chiropractic care. Our guest today is Dr. Dane Donahue. He's been a chiropractor for 30 years, a well-recognized speaker and author in the chiropractic world, a graduate of Texas Chiropractic College, and a recipient of many awards, and perhaps most importantly, an advocate for his patients to feel better, make healthier decisions within supportive environments, and proven clinical systems. He's also the creator of 8 Weeks to Wellness, a proven model that helps chiropractors implement a comprehensive wellness program that encompasses all the fundamental wellness therapies to deliver drastic results in many aspects of their patient health. Welcome to Beyond the Scale, Dr. Donahue. Thank you for joining us.
Thank you so much. It's a pleasure to be with you.
Fantastic. Well, take me back. Where did you get your start? How did you develop your passion for what you do today? And how would you describe your philosophy for care?
Well, in speaking to a lot of chiropractors and having a lot of chiropractors in my family, most people, I think, come to the functional medicine or chiropractic space in one of two ways. They're either born into it or they have some sort of a crisis in their own life that draws them to functional wellness, and they get interested and kind of go down that avenue. And I was blessed to have a father and a grandfather who was a chiropractor and two uncles. So I was, from birth, I was surrounded not only with chiropractic, but what I call the chiropractic lifestyle. I grew up, playing sports, but, having a dad as a chiropractor, being adjusted, talking about things like nutrition and exercise, and it was just kind of a part of my life. So it was just a natural thing for me. And seeing my dad's practice, my dad actually had a home office. So it was kind of interesting. I got to actually meet some of the patients and see some of their transformations. And I love the fact that, my dad helped people in a natural way with his hands and his mouth, through education and also using his hands to adjust people and help them structurally and posturally. And it really left an impression on me. So that's kind of what motivated me to go into chiropractic college. So I went to undergraduate and went to where my father and my grandfather both went to chiropractic college, which was down outside of Houston, Texas. And I graduated in 1991. And, I was in practice for probably about 10 years. And I have to say, I got a little disenfranchised, maybe a little bit burned out, because I saw people coming in with the same problems that were really, I think, manifested through their lifestyle. They may have been carrying a lot of weight. They were under muscled. They had poor posture. They sat all day long. They had horrible diets. And I knew if they lived a different lifestyle, they would have different health outcomes. And that really forced me to take a look at what I was doing and the kind of the model of my practice, how I was taking care of patients. And I actually was blessed because I have a twin sister, and she was an engineer in her early career, but was kind of burned out from engineering, went back to school to become a chiropractor, and she joined me in practice. And we sat down one day and this was about 2003. So I'd been in practice probably about 12 years, and said, what can we really do to help our patients? And that's kind of where 8 Weeks to Wellness was born. We knew it kind of needed to have a defined time period to it, because at the time, I think people weren't willing to commit to something for a lifetime unless they saw results. And we also knew that it needed to include the fundamental wellness therapies. In chiropractic, we talk about the triune of health, and that triune is a triangle, right? And it's equilateral triangle that consists of physical, right? So exercise, posture, your structural well-being, injuries, things like that. Then you also have chemical, which would be your nutrition, your supplementation, any chemicals that you're exposed to, toxins, things like that. And then the last part of that triangle is, I think, a very important one that I think oftentimes gets overlooked, and that's the mental emotional aspect of health, how we manage stress, our thought life, those types of things. So we developed the program around those three fundamentals, and that's where we came up with the 5 fundamental therapies of 8 Weeks to Wellness. And we also know that we needed to measure people's physiology. As I tell my patients, physiology doesn't lie, but sometimes people do. We lie to ourselves about how healthy we are or aren't. So we love numbers, because numbers really tell the tale of what's going on with a person's overall health. So we do what we call wellness score pre and post 8 weeks. So we include labs and important numbers like InBody numbers. Probably one of the most important things that we measure is how much muscle versus body fat a person has. So that's where we kind of got introduced with InBody a long time ago. And it's been a really valuable part of not only our 8 Weeks to Wellness program, but our practice as well.
Take me back then to when you were thinking about getting the InBody. What kind of things were you thinking at the time? Obviously, the muscle and the fat were important, but what led you to choose InBody?
Well, we had been doing body composition for quite a long time before we started with InBody. We were using a couple units. Our last one prior to InBody was the Biomarkers 2000. So we had already been doing bioimpedance analysis on our patients, and it was already a part of 8 Weeks to Wellness. And we got introduced to InBody through, it was a doctor named Robert Silverman. I don't know if you're familiar with him, but he speaks a lot in the functional medicine space. And once I saw it, and at the time, Jeff Mangold, who was the person that kind of introduced me. And once I saw it and saw the reliability of the unit, and saw how much easier it was than putting pads on people, and it just had a better reproducibility as well. So that's how we got introduced in it. That's probably, I would say, a good maybe 10 years ago.
Yeah, you've been helping grow our business and also yours by promoting the InBody to many providers within your 8 Weeks to Wellness network too. For our listeners, can you tell us more about 8 Weeks to Wellness and what that is and what type
Sure.
of people you would serve there?
Sure. We use a model, not only with 8 Weeks to Wellness, but when I speak to doctors, I call it, give people what they want, but show them what they need, right? So, most people go to the doctor because they have symptomatology, right? They're not feeling well. So we want to obviously address the reason that people come to see us. And in a chiropractic setting, obviously we deal with a lot of pain syndromes. But in my office, we also deal with a lot of metabolic issues, diabetes, prediabetes, autoimmune issues, gut issues. We see a lot of these issues as well because they're referred by patients that we've helped with similar conditions. But, again, the show them what they could have is the really important part, because as I teach my patients, there is a law of cause and effect. For every action, there's an equal and opposite reaction. And in this country, we've developed a sick care system that is focused on the wrong side of the equation, right? We focus on the effect side and not the underlying cause side. And I could go into a long discussion of why that is. I really think that it's financially driven. Nobody makes a lot of money when people are healthy, but there's a lot of people that are making money off of people being sick. So there's not an incentive to really keep people healthy and get them to change their lifestyle. And I think most doctors know this, and most healthcare professionals know this. So, we developed that program with that in mind. And like I said, we have 5 fundamental therapies within 8 Weeks to Wellness that a patient does. They're getting adjusted and working on their posture. They're doing corrective exercises. So we focus on 3 dimensions of exercise: cardiovascular endurance, mobility, and also strength. And then the third part of the program is nutrition, obviously. Our nutritional program is pretty simple. We really focus on insulin levels, trying to get people to eat whole foods. And then the fourth part is massage, and the fifth part is meditation and mindfulness. And we have a real nice structure to it. So it's almost like a roadmap that we give patients, and they know exactly what they're doing. They work out with trainers. They know exactly what they're eating. They meet with a health coach every single week that takes them through their nutrition. So it's pretty structured. And I feel that people need a good plan and a good coach to be successful. As I tell my patients, if you could have done this on your own, you probably would have figured it out by now. And the reason that you haven't is either you don't have a good coach, you don't have a good game plan, or you don't have the desire, right? So a lot of people, they may have a good coach and they may have a good plan, but if they don't have the desire and the motivation, and they're not inspired to really want to make a change, it's really not going to work.
That's so true. I have an acronym I like to share, EMACK, and I think about it in health coaching with patients. Like, efficiency is so important for people to be able to fit things like this into their life.
Sure.
Motivation, what's driving you or not driving you. I've even experienced it in my life where I'm not motivated at this point, even though at other points I was, and I was doing well. But we go through these dips and peaks and valleys for that. Accountability, what's holding us accountable or not. Consistency and commitment, and then knowledge, whether I have the knowledge to be able to do those things. So it's super important to have support for all of those things. And I think it's often overlooked in healthcare. For our listeners, if you want to follow along too, if you go to 8ww.com, that's 8 weeks to wellness, you've got the journey mapped out really well on here. And one of the things I see is the wellness score. Can you tell me a little bit about your process in developing that and what that includes?
Sure. As I said, give people what they want and show them what they could have. And, there are certain biomarkers that I think that we don't focus on enough in healthcare. Simple things like blood pressure, resting pulse, muscle mass, obviously, functional movement, those types of things, posture. We do digital postural pictures of our patients. It's amazing the changes that we see in our patients in 8 weeks, not only with body composition, but with really structural and postural changes. And, I think about this, all these little things, they make a difference. So the wellness score is really just looking at different aspects of physiology that are important to not only the short-term health of the patient, like, are they inflamed? Are they dyslipidemic? Are they dysglycemic? All of these things, we have so many tools within just using labs alone, but then looking at other measurements as well. Like we said, using the InBody. Most patients, when I sit down with them, they've never seen an InBody. They've never seen their body composition. The only thing that they really know is the scale. And, the scale can be very misleading. So being able to sit down with a patient that maybe is coming in pain, as I tell people, I guess a good way to put it is, healthy people heal better. The word heal is actually in the word health, HEALTH, right? So I find that my patients who are healthy, they heal a lot quicker. They do a lot better under care. So the goal is not only to focus on what brought them into the office, right? Whatever pain syndrome they're having, or whatever problem they're having, but to focus on getting them healthy so that they can heal better. And I think physiology is a really good reflection to the patient of how healthy they are. And there's, with the wellness score, I tell patients, I tell doctors, I really don't care what you measure, but you should be measuring something to know whether you're making an affect in your patients, pre and post under your care. Are you truly just treating symptoms? Are you really changing their physiology?
Take me into your experience when you've got the InBody result sheet, someone's done the test and it prints out. What does that consultation sound like for you? What kind of things are you stressing that are really important in that experience for them, whether it's the first test or it's, ongoing through their journey in your clinic?
So we take the data, the wellness score that we have is actually a report that we print up for the patient. It actually gives the patient a grade. So imagine getting a grade when you go into a doctor's office, A through F of how you're doing with your health. And patients understand grades. They know what an A means when they were in school, and they also know what an F means, right? We never wanted to bring an F home to our parents, right? But we certainly love bringing home the A. So we give them a grade. And part of that is using the InBody assessment and the specific, obviously there's a lot of information, there's a lot of information on the InBody that we could use, but we use certain data points within the wellness score. We actually go over the results with the patient, but we also put 4 or 5 metrics within the wellness score that we think are really valuable, and that is skeletal muscle mass. We also use the ECW, TBW, extracellular water to total body water, their percentage of body fat. We use that as well. And the visceral fat index are the 4 probably that are most important to me. So we want to know, body fat percentage and body fat mass. So how many pounds, what percentage of their body is made up of fat. We want to know skeletal muscle mass in pounds. One of the things that I find helpful, based on age is telling a patient how much muscle versus body fat they should have. So, with a younger person, a male, we're talking about, how old are you?
38.
38. So if I was talking to you, I would tell you that, anybody your age should have at least 3 times as much muscle mass compared to body fat, right? So we can look at that and show them. So let's say that you have, 90 pounds of muscle, which would be really good for somebody who's, 5'9", 5'10". I don't know how tall you are, but you look like probably about 5'10".
Yep.
Yeah. So 90 pounds of muscle would be great, right? But a lot of times somebody will come in and they're athletic and they have 90 pounds of muscle, but then they have 60 pounds of body fat, right? So they're not in that ratio that we want them to be in. So depending on age, a male should be 3, as they get older, 2.5, 2 to 1 muscle to fat. Women should really want to be, younger women should want to be 2.5 times as much muscle to fat. Older women more like, 2 to 1.5 times much muscle to fat. And people understand that. I have a block of an anatomical model of fat in my office that I literally show a patient when I sit down with them. This is a pound of muscle, this is a pound of fat, this is 5 pounds of fat, this is 5 pounds of muscle. It makes it real. Have you ever seen that chunk? I wish I had it, but I'm at home now. But have you ever seen that 5-pound chunk of body fat? It takes up a lot of space compared to the muscle.
Yeah,
So,
absolutely.
I think using visuals is really helpful when going over the InBody results as well.
Another visual I like to coach clinics to think about is perhaps having a picture of the CT scan of visceral fat in and around the organs, so you can actually see what the visceral fat looks like as well.
Yeah, we have that as well. I have a really nice image from a study that was done on sarcopenia, and it shows a femur with a 70-year-old man and a 40-year-old man, and the 40-year-old man is very sarcopenic, a lot of fat, and the 70-year-old man has a lot of muscle, and you can see the difference between the muscle and the fat. But then also, like you're saying, showing them a picture of a heart loaded with visceral fat, those things get their attention.
Absolutely. Tell me a little bit more about that ECW TBW ratio. That's looking at how much extracellular water is within the total water. Commonly, people think about it like an edema index, perhaps too. But how does that play into your wellness score? And then what kind of coaching are you doing around that over time?
So it's interesting, in using the InBody as long as I have, I find that I can almost predict if a person has a good diet based on that number. And generally, if they're taking really good omega-3s versus not, you'll see a change in that number. So a lot of times you'll see somebody who looks relatively healthy and they may have a higher number, let's say, over 0.38. And I almost always ask them, do you take a good omega-3 supplement? And almost always they tell me no. Also you're going to see your smokers, your people who have a really poor diet, that eat a lot of processed food. So obviously, toxins, we're going to pull water from a, higher concentration to a lower concentration. So when you have a higher concentration of solutes and toxins outside of the cellular medium, you're going to draw water out of the cell, which is going to change that number. And that's how I explain to patients. I use the analogy of obviously a grape and a raisin. Patients understand analogies. So I say, listen, the only difference between a grape and a raisin is they're the same fruit, right? When you think about it, they look completely different. You wouldn't think they're the same fruit, but you squeeze a grape and what comes out is water. You squeeze a raisin, nothing comes out. And so do you want your cells to be grapes, or would you like them to be raisins? Would you like your skin to look like a raisin, or do you want it to look plump like a grape? And that's where that number really makes a difference. And like you said, I always talk about edema with patients because they don't really understand the term. as water flows outside of the cell into the extracellular space, it gets drawn down into the legs, right? And especially if they have cardiovascular issues where they can't get that fluid back up to their heart, that's going to cause edema. And people understand edema, they just don't understand the physiological process that drives edema.
Yeah, so much of it comes back to the metabolism, and you mentioned metabolic syndrome earlier, and just being able to show how a lot of these outputs would impact their overall metabolic rate. One of the things that I think is super important to metabolism is what we're metabolizing, which would be the nutrition in the food that we eat. How does that play into your program? And are you using the BMR, the basal metabolic rate, on the InBody there?
Yeah, so we have a really great coach. I don't have the time. I see a lot of patients, and I don't necessarily have the time because obviously nutrition takes time. Sitting down and educating patients takes time, and in our healthcare system where a doctor has 5-10 minutes, and they don't have a nutritionist on staff like I do. And I really call her a health coach because I think she's so much more than just a nutritional coach. She'll sit down with patients and she really uses the InBody and that number, the BMR number, to show a patient, where they are in terms of burning calories, and obviously the more muscle they have on the body, the higher their BMR. But, utilizing that to talk about macronutrients, carbohydrates, fats. I just was speaking with a woman yesterday and she's very, very frustrated. She's 56 years old. She's an avid tennis player. She's got bad knees. She's overweight. She's postmenopausal now. And she doesn't understand why her body is changing and why she's putting weight on when her diet is what she thinks is good. And being able to talk to her about her basal metabolic rate and show her she plays a lot of tennis, but she's losing muscle mass, right? And she's gaining visceral fat. And so to be able to have that conversation about her nutrition, and when we kind of dug in, we recognized that she eats way too many carbohydrates. She's not getting enough protein, and she's eating a lot of carbohydrate-rich meals without any protein or fat at that meal, which is going to slow down the rate at which sugar gets absorbed and gets converted to fat. So, and being able to talk to her about that and her basal metabolic rate, it's just a really powerful tool.
Let's switch gears a little bit and talk about the return on investment that you've experienced through the lens of the InBody. Sometimes it comes in a direct method where somebody's actually accepting money in exchange for the time to do the test and the interpretation, but a lot of times it's indirect too. So have you seen any balance of those two, or how does it show up in your practice?
Well, I think it's huge. Like I said, give people what they want, show them what they could have. One thing I've come to learn is people can't change something they're not aware of. Right. And I'm going to say that again, because I think it's simple, but it's so profound. People can't change something they're not aware of. So if you're not showing them their body composition, how are they ever going to elect to, engage in services that you can charge for if they don't know they have a problem, So I think it's huge. And we've had so many patients over the years who have started 8 weeks to wellness that came in for back pain, came in for headaches. And we did their evaluation with their wellness score and their InBody. And they're aghast to know that their visceral fat is 20, that their muscle mass is, are very sarcopenic. And we can have these conversations with them and drive them into 8 weeks to wellness to get them healthy so they heal better, so that we can not only address whatever brought them in this case, their back pain or headaches, but also get them healthy, and drive them into one of our programs like 8 weeks to wellness that obviously we charge for. And these are cash-based services too, by the way. So these are things that people are more than willing to pay out of pocket for. And I always say, I believe that patients pay in direct proportion to the value that they see and experience with your care. So if there's no value, they're not going to want to pay for it, or they're going to want their insurance to pay for it, right? But if they see value, meaning that somebody referred them, that they see a massive change in that person, either their energy level, or they look different, or they lost weight, or there's a spring in their step, and they're coming in already telling me, my sister did 8 weeks to wellness and she looks amazing. She raves about your program. They're already sold. I mean, I don't have to do much to convince them because they see it in another person that they care about, So I think, it's huge.
Yeah, it sounds like it's helped with the perhaps the conversion of patients into your programs. and also the marketing of the programs where you're validating it in itself because people see it, and it kind of becomes your brand, if you will. Has the InBody fit into any other parts of like your marketing? Where are you using
Yeah, we
educational content around it, or are you leveraging it within your branding?
Yeah, so one of the things that we do is we take the InBody on the road. I have a little generator. So if we go to a fair, or we have just had something in our town called Welcome Day, which is they just, we have a borough, a little town, and they close down the streets, and they have a bunch of vendors, and we can go and meet the community, and we bring the InBody to it. It's not that heavy of a unit. We have a generator if they don't have electricity. We bring our printer. And it allows us to, people see the unit and they're like, especially if they see somebody getting a test, they're like, what's that? It really piques their interest. So we run a lot of InBody scans, and it gives us an opportunity to talk to people about body composition. I always tell people number one biometric of aging is loss of muscle mass. And that gets their attention, right? Nobody wants to get their body fat checked, by the way, especially if you're a fair. So don't talk about, hey, come get your body fat measured, because they're going to walk they're going to do laps to try to get away from your booth. But if you talk to them about muscle mass, come get your muscle mass checked, people are interested in that. And so, you can talk to them about how loss of muscle mass is one of the biggest predictors of decreased quality of life. I mean, there's now studies that show that loss of muscle mass is a bigger driver of quality of life loss than cigarette smoking, right? I don't think the average person in the public knows that.
I have a pharmacist friend. Her name's Dr. Kathy Campbell, and she often talks about how she heard a study that was done once where there were people that were smoking and drinking alcohol that were living longer than people that had poor body composition. And I think having low muscle is one thing, but also the functionality, I hear you saying, in terms of like the quality of life, being able to function with that muscle is super important too, alongside of it. Do you measure grip strength at all in your
It's
practice?
funny. I was just speaking in Florida, and your team was there, and I saw the thing. So it's actually being delivered on Monday.
Great.
I did, yep. So I do grip strength as a part of our wellness score. I just didn't have your unit. So I've always done grip strength, but now we're going to be using I forget what it's called, but the grips, what's
We
it
call
called?
it in grip, in
In
body,
grip.
in
Yeah.
grip. Yeah.
Yeah. In grip, the in grip.
So, are there any other assessments that you're doing alongside of the body composition besides grip strength to measure functionality and strength?
Yeah. We do a functional movement screen. We do 8 functional movement tests. It's pretty easy to do. We do 4 for core flexibility, and we do 4 for core strength. So looking at a person, how they hinge, like doing a deadlift, a simple deadlift with a piece of PVC. We look at their squat or their overhead squat. We do something called a shoulder pass through to check shoulder and upper thoracic mobility. We look at hip rotation. So we do a functional movement screen as well. And again, one of the powerful things that we do is the postural pictures. And with the men, we do it with their shirts off. And that's pretty interesting too, because when you combine the InBody with taking a picture of a person, especially a male with his shirt off from the front and the side, we obviously don't do that with the women, but we have them wear something like yoga clothes where it's tight fitting, so that they can really see what they look like. I think people walk by the mirror and they look in the mirror, but they don't really see themselves. And so being able to see a picture of themselves, and again, we're doing it for their posture as well. So there's kind of 2 reasons. One that's, a little hidden for us. We're showing their posture and all the deviations in their posture, but then we can say, okay, now, your visceral fat index was a 20. And when we look at you from the side, you see all this visceral fat in your belly, all this that's hanging over your pants. That's all the visceral fat. You don't have any really bones in your waist except for your spine, and it's not that big around. All of this is just accumulated visceral fat. And then you can talk to them about cytokine storm and, all the inflammatory implications of having a lot of visceral fat driving, a lot of cytokines and, increase in all kinds of things because of the cytokine infiltration.
So obviously the InBody is quite an objective measurement and a picture is quite objective and the assessments are, but there's a human behind it and behind all of these numbers. And I'm curious from your perspective, whether, how do you coach your team or how do you approach the softer skills necessary when you're talking about things like this that can be kind of sensitive to people
Mm.
that, you know, they might get kind of emotional or you might want to, handle it softly with them. How do you approach that?
It's such a great question. I would have to say in the beginning, I was definitely probably more sensitive. And I like to think that I'm still sensitive and empathetic, but I'm also a doctor, and I'd rather tell the truth, right, than lie to a person and to make them feel good, only for them to, have a consequence. And I can't tell you how many patients over the years that I've done their wellness score. And I knew it was bad. I knew it was a ticking time bomb that was ready to explode. And those patients aren't with us anymore, you know. And some of them were younger than I am, and I'm 55 years old. And they went on to pass away of a heart attack or, or diabetes or something like that. So I feel as a doctor, doctor means teacher in Latin. We know that. It's my job to teach and be empathetic, but, tell the truth. And so it's a great question because I know exactly what you're saying, and I feel it when a person sits down. I can't tell you how many women I've had with tears in their eyes as I've gone over their InBody, because I think it's a hard dose of reality when they're looking at those numbers, and I think deep down inside they know they've kind of been failing themselves and failing with their health, and then it all comes out. And I have something kind of funny that I do. I have tissues. I literally have tissues on my desk. I hand them a tissue and I say, this one's free. The next one's going to cost you $1. You just make it lighthearted, and, because they do get upset when they see those numbers sometimes. So, but I do it on almost every patient. That's the other thing I would say is don't do this selectively, do it on every one of your new patients because they deserve to know this information. It's so powerful and it may motivate or inspire this person to make some changes.
What other kind of tips or tricks or experience can you share around the InBody for somebody maybe thinking about getting an InBody or somebody that has one that wants to optimize it in their practice?
Yeah. So I would say the first thing, again, if you have one, I have one of my doctors who keeps the InBody. I don't do this because I have a long walk from my reception area to my office and the exam room. And that's where we keep our InBody. But I have a doctor that keeps it in his waiting room and reception area. And so people see it and they're like, hey, what's that? And it sparks a conversation and he'll have one of his staff members run the InBody. So I would say, make sure you're performing the test on, like I said, all of your new patients. The only time I won't perform the InBody is I have a patient that literally is in so much pain they can't step up on the InBody. But almost everybody else is just part of our normal procedures. Patients go to the doctor, they're used to getting poked and prodded and getting their blood pressure checked and having all these things. It's just a part of the normal procedure. So just make it a part of your normal process to run their InBody. It literally takes several minutes, or have your staff do it. And then you have that information to go over with them, on their reported findings or when you go over their care plan. So I would say that's a big thing is make sure you're running the test and make sure that patients see it, so that it drives a conversation. And you asked me something else about that. I forget what it was.
I think more of just like how to, anything else that you want to share that I guess we haven't talked about related to the InBody in terms of implementation. And maybe we come back to it in a minute because I want to pivot to, this is offline. I'm going to edit this out, but
Okay.
I want to come back to 8 weeks to wellness and start that kind of journey. And maybe we can talk about it from that perspective of like, now you're working with other chiropractors and you're helping them implement the InBody, and maybe that'll give us more context to add a little more detail there too.
Oh, I
Sound
know
good?
what you were asking is that if somebody doesn't have one, why would they consider getting one?
Oh yeah, for somebody potentially thinking about getting one
Right.
or somebody that already has one, just
Yeah.
more general. But
Yeah.
let's pivot here and let's talk about 8 weeks to wellness a little bit more and take me back. What was your indication in the beginning that you needed to create a program, or why did you want to create a program? Because obviously you're doing well for yourself. but what inspired you to want to go out and help others implement something like this in their practice?
Well, I think it was twofold. I think growing up in a chiropractic family and a chiropractic environment where health was a priority, I always say the things that matter most should never be at the mercy of things that matter least. And actually, Stephen Covey said that first, but I love it. It's kind of a mantra for my life that things that matter most should never be at the mercy of things that matter least. So we get to choose where we spend our time and where we spend our money, which I believe is a reflection of our energy. And so you have to ask yourself what's important. And I know for me, and I learned this through my family, is that when I function and vibrate at a very high level, I can get a lot done. I can help a lot of people, right? And I know that my own happiness is tied to being able to serve others, serve my family, serve my patients, serve my friends. And when I'm serving at a high level, I feel better about myself, right? And so I can't give from an empty cup, I have to fill my cup up. And so health was always something that was a priority to me. And so, growing up with that philosophy, when I got in practice, I was, again, like kind of disenfranchised because I'm like, people don't live this way. It's kind of like they just don't, they don't eat well. They're not exercising. They're not getting adjusted. They come in because they have pain. I'll see them for a little while and then they disappear again. But they don't make it a part of their lifestyle, and again, I always tell my patients, it's really about deposits and withdrawals. It's not that I'm a perfect eater. It's not that I never miss a workout. It's not that, I get adjusted, every single day. But these are deposits for me, mindfulness. I don't meditate every day, but I'm a good, probably 4 or 5 times a week. I'm meditating in the morning and doing some deep breathing exercises. So it's deposits and withdrawals. And when you make more deposits than you make withdrawals, you have reserve capacity to draw upon when you get older or in your life, right? But if you're making more withdrawals, eventually you're overdrawn. And when you're overdrawn with your health, that's called a heart attack. That's called being diagnosed with diabetes. That's being diagnosed with cancer because you've made more withdrawals and more stress on your body than you have deposits, right? And so I try to really teach this to my patients. And, I guess for me, when we started 8 Weeks to Wellness, I just was fed up that people they always had excuses, but they didn't really take action. And so I'm like, we're going to help them take action. We're going to create a program where they're going to do it. We're going to walk alongside them and make sure they do it. When they have an appointment, they show up and work out at our office. They show up and meet with a nutritional coach who's going to review their nutritional log to know exactly what they're eating, and so it's a lot easier when there's that level of accountability to be able to help a patient rather than just tell them what to do. It's what's the saying? Give a man a fish, he eats for a day. Teach a man a fish, he eats for a lifetime. And I would just say, if you teach from a standpoint of really, getting them involved in the process, getting them involved in the process of what does good exercise look like? You give somebody an exercise sheet, but I know if I give them a sheet, they're going to do it half-assed. They're not going to do it right. But if I have one of my trainers go through it and teach them how to do it right, and then set them up on a schedule where they either come into our gym, right, our fitness center, or at the very least, we know when they're going to be doing these exercises. There's a level of accountability where there's follow through. So I think there's a lot of education. It's like, you're mnemonic, one of them was knowledge, right? And knowledge is great, but knowledge that isn't implemented is not great, So that knowledge has to be implemented, and that's where the rubber meets the road, and that's why people are failing. And there's tons of books and knowledge out there, podcasts and internet, but it's the application of that knowledge that's super important. And that's why we developed 8 Weeks to Wellness, is to help them apply the knowledge and hold their hand along the way. So, when invariably they're going to make mistakes, we can be there to pick them up.
When did you start teaching the 8 Weeks to Wellness foundational principles and systems to other chiropractors?
So we launched the program in 2003 in our office. It's kind of an interesting story because we had a pretty good practice. We were, probably a 50-50 insurance cash practice, probably close to $1 million. And inside of, I want to say from 2003 to 2007, our practice went from about 900,000 to 2.2 million. And it was all cash, right? So we went from a 50% cash model to a 70% cash model, 30% insurance inside of 3 years, creating 8 Weeks to Wellness because it was a cash-based program. And we just saw such great results and got so many referrals because people were just really doing well in the program and referring their friends and their family and their coworkers, that it really just took off. And once we did that, we started having friends of mine who were chiropractors who saw my practice and saw what we were doing and said, "Hey, what the heck are you doing? I mean, your practice is exploding." And so we started to actually, my sister and I started to teach the model to some of my friends who were chiropractors. And then from there, we got involved with a chiropractic coaching group that saw our numbers and saw what we were doing and the success of our practice. And we developed kind of like I don't want to say a franchise, it's a distributorship model where we can teach other chiropractors and they can use the resources and tools that we've created within 8 Weeks to Wellness. And we coach them up to how to implement 8 Weeks to Wellness in their practice.
Do you have different stages that the provider would go through as they're working to implement 8 Weeks to Wellness into their practice?
Yeah, great question. Some doctors don't have the space or the wherewithal, or maybe even the managerial energy that I call it. Because when you're managing nutritional coaches and trainers and chiropractors and your front desk team, it's a lot to manage. I know that from personal experience. So not every doctor wants to do that. I get that. But it takes the space. We have 10,000 square foot facility. 5,000 is devoted to our functional training facility, and we have 3 doctors, and we have a lot of space. Not all doctors have that, but we grew into that space, right? We didn't start there, we grew into that. So there are phases, and I would say the first phase for a doctor is maybe look at the wellness score. Look at measuring these metrics in your patients so that you can then report to them what's going on physiologically and functionally to your patients. Now, maybe you don't have the platform within your practice to be able to help them, hold them accountable to making those changes. So maybe it is more just knowledge driven at this point. But you can still sit down with them and coach them and give them tools and resources to help address some of these changes that they need to make physiologically with their in-body results, with their lab results, these types of things. So I would say the good place to start is looking at the wellness score and implementing your own wellness score. It's like, if I asked you as a doctor, what's important? What are the 10 things that absolutely you should be measuring every single patient? I know my 10. I know what I would say. But maybe my 10 is not the same as another doctor's 10.
Take me through some of the success stories that you've experienced with other doctors and helping them through implementing your system and evolving over the years. Since what year did you say you started, in 2003?
Yeah,
Or
2003. And then we probably launched 8 Weeks to Wellness in about 2010 to the chiropractic profession and other doctors. We've had medical doctors implement 8 Weeks to Wellness in their practice as well, which I think is awesome. Yeah, I think of many doctors, and the positive effect that we've been able to really see, not only in our patients, but now we have doctors who are helping other patients, and it's just grown exponentially. So we're not helping the hundreds of patients a year that we help, but we're literally helping thousands of patients. We have one doctor who's a very good friend of mine in Minnesota who just sees a lot of patients, and him and his wife are very passionate about 8 Weeks to Wellness because they've had kind of their own journey with their family. They've lost some close members of their family who died unnecessarily because of metabolic disease. So it's kind of hit close to home for them, and they're real advocates for the program. They live the 8 Weeks to Wellness lifestyle themselves, and they're real advocates for their patients. So it's been wonderful.
when you're helping other doctors implement the InBody into their practice, what are some important things that you're helping them become aware of or consider as they implement it?
I would say, the biggest thing is, as we really, our 8 Weeks to Wellness doctors can't practice without an InBody. And we just tell them, like, it'd be like a carpenter not having a hammer, right? It doesn't make sense, right? You need this tool. It's a very powerful tool with your patients. So, when a new doctor's coming on to 8 Weeks to Wellness, I think that, it's like anything that you get, that, initially you don't understand. It comes in this big box, or, you see this printout, you really don't understand the science behind it. So we really take time to educate them on the result sheet, on what the numbers mean, on how the technology works, because some people want to know, well, how does this work? So people don't understand about bioimpedance and different tissue compartments and things like that. So I think we spend a lot of time initially with the doctors getting them to understand the science behind BIA and behind the InBody, and then also the result sheet. Again, you can spend probably 30, 40 minutes going over all of the result sheet, but you don't necessarily have that time. So, which of the numbers that are really important, either for, that particular case with the patient, or just, again, if you're doing, more things for longevity, which numbers would be more important on the result sheet. So I think, the more time we spend educating our doctors and getting them to feel comfortable about communicating, so you've got to be able to communicate this to the patient in a way that makes sense to them. You can't just throw around, a lot of big terms. You say ECW to TBW. Well, your ECW, TBW is this. That means nothing to a patient, right? You've got to be able to communicate what that means. So I think, the understanding and time that we put into educating them to really understand the interpretation and result sheet and really understand a little bit of the science behind the InBody pays dividends for the doctors, and then feel confident being able to communicate with it. One of the things I do with my doctors is really interesting. I say, okay, and I don't even tell them I'm doing this because I want to see how they do off the cuff. I'll say, okay, let's pull out an InBody, and I want you to go over it with me as if I'm the patient, right? And they think in their mind they really understand it and understand the result sheet, and then they start going through it, and it doesn't sound so good. And if I'm the patient, I'm like, okay, well, that didn't necessarily make a ton of sense to me, right? So, and I know that it's because they don't feel confident with it. They haven't put the time into really understanding it, or haven't put the time into really how to communicate it. I've done it so many times that when I get a result sheet, it's like, for me, it's second nature, but I'm always trying to improve things like through storytelling or analogies, that I can use to get the patient to understand that information just a little bit better. So if the doctor's not putting the time into into really the education, the science, the communication of the tools, it's probably not going to go that well and then you're going to get frustrated, and then you're going to be more adverse to actually wanting to run the test.
Absolutely. And one of the things that I think we find helpful for when people are implementing this as well is testing yourself, whether you're a doctor or if you're a doctor, having the rest of your staff test and maybe doing this monthly, and then practicing that interpretation, I think is a great thing like you're sharing. Um, but practicing with one another also within a clinic too, and having the staff involved in this process can help support the implementation, the awareness around it, leadership around the tool, and being able to position it within the business and everybody on the same page.
And that's such a great point, because our team all know how to run the InBody. They get the InBody run on themselves. They don't necessarily always love me going over it with them because they don't want me to know their numbers. But that it's a powerful tool. We're doing something right now, and we do it twice a year in our practice. My wife and I actually do it, and we invite our patients to do it with us. But the first Monday after Labor Day and the first Monday after New Year's, we do a 10-day cleanse detox, and we invite our patients to do with it. We use a couple products from a company called Nutridyne. We have a specific diet. We have a guide that we give our patients, but we run an InBody pre and post. So at the beginning of the 10 days and at the end of the 10 days, we also give them something called a medical symptom questionnaire, which is like a questionnaire that really focuses on toxicity and what symptoms they may be expressing because they're toxic or inflamed. And we have them fill that out pre and post. And it's amazing the changes in their MSQ, their medical symptom questionnaire. I call it their symptomatic load. And then also their InBody in just the 10 days. I'm in day 5, and I can feel such a difference in my visceral fat like after 5 days. It's very motivating to me because I know the summer I love to have a good time. And I had a good time this summer, went on some vacations, and wasn't great with my diet. I was pretty good with my exercise the whole time, but definitely ate some things that I'm not proud of. But I'm a human being, and that's what we're going to do: deposits and withdrawals. And I made some really nice withdrawals over the summer, and I do that over the holidays too. So it's a great time for reset with our patients, and we have a bunch of our patients now that are doing this on a yearly or bi-yearly basis because it just makes sense, right? And we use the InBody as part of the process to show them the changes of just what they can do in just 10 days.
That's a great point. Two things that I want to dive into a little bit more. One is supplementation, because I feel like that's a great avenue where body composition can support that, as you're showing alongside of this detox. And the other is a wellness challenge. And you sounds like you started it for your own health, but it's spilled over into your patients. And I see a lot of people that have business models where they're able to create and promote to their community, we're going to do this challenge starting on January 1st, and it becomes a really great marketing drive for their business to grow that way. Is that something you've seen too, or has it kind of just been happenstance that it kind of came upon it for you?
It's probably a little bit of both. We definitely through the fitness center do some wellness challenges, and the InBody obviously is an important part. We have a CrossFit in our space as well, and they use the InBody a lot as well for their fitness challenges. And patients love a challenge. I think it's and clients as well that are clients of the CrossFit and of the gym. So I think people love the idea of a challenge, and people need that too. It's like we all need, something that's going to help us to be more disciplined, and sometimes the challenge is like, I always find that people do better with rules. If you don't tell me the rules, I'm going to make up my own. But if you give me the rules and give me the time frame and you give me, specifically exactly what am I supposed to eat? When am I supposed to exercise? It's a lot easier for me to follow a map, a roadmap, than to try to figure out how to get from point A to point B without a map. So I think that the health challenges are really a great idea. And they, like I said, our patients love them.
What about supplementation? Have you seen any increase in revenue from that, or how does it relate to body composition?
We do a lot of supplements. We use a company called Nutridyne out of the Midwest, and it's a big part of what we do. We have our core supplements that I think everybody should be taking: omega-3s, vitamin D3, and a really healthy probiotic, as long as you don't have SIBO or some other gut issue. But yeah, I mean, supplements are a huge part. I could go into an hour on supplements, but obviously with body composition, like the detox that we're doing now, we use 4 products for that. Targeted at methylation in the body and liver cleanse, and also targeted at GI, clearing out the GI system and improving inflammation and kind of sealing up the gut. So supplement is a really big part of our practice.
Fantastic. Is there anything else that we haven't talked about that you want to share? Things that you riff on that you're passionate about, or anything?
No, I mean,
more?
I do have another call in 4 or 5 minutes that I got to jump
Cool.
on, so we can wrap it up. But I would
Yeah.
just say in finishing up the call, I'm kind of proud. My youngest son is in chiropractic college now. He'll be a 4th generation chiropractor, and it gives me tingles when I don't even know why I'm getting emotional, but I'm really proud of that. I'm proud to be a healthcare provider, not a sick care provider. And we need to start putting the passion back into knowing that we help people. And I think you become more passionate when you actually help people make changes. Like when people see the change in their InBody, that's not something they did with drugs, right? That's something they did with hard work. And people become really proud of that. And when your patients are proud and your patients are getting amazing results, you form a relationship with them. They look at you as somebody who has really made a difference in their life. And that's a really special thing when somebody has that relationship with you. I have so many of my patients. I tell my wife all the time, my wife runs my practice, but I'm like, Joe, we have so many awesome patients, and I love going to my practice. Doesn't mean that it's not hard work. It's hard work, right? But I love going through the door in my office. It makes me feel good that I'm doing something for somebody else and they pay me for it. And I've developed these great relationships, and it's all based on getting results, right? And it's great to have a great relationship, but when you have a great relationship and you get great results with your patients that you can document, it takes it to a whole another level.
You are such an awesome healthcare provider, and I'm grateful for you being our customer. I want to thank you for that, and also for you sharing your time here with us today. I hope that everybody gets a chance to check out what you've got going on, connect with you through 8 Weeks to Wellness, and learn more. And many blessings to you on your journey forward.
Yeah, and thank you so much. And I'll just throw this out there: if anybody through the website wants to reach out to me, if you have any questions, concerns, please, this healthcare space and has been really good to me. I live a really good life because of what I do. And I think the best way that we can be appreciative is to pay it forward. So if somebody's out there and they're thinking about InBody or supplementation or adding functional medicine to their practice or just dabbling and, they want to reach out and talk to me, we've been doing this a long time and we can kind of help steer you in the right direction.
How would someone directly get in touch with you?
So my email is super simple. It's just my name, Dr. Dane Donahue, Donohue @gmail. That's probably the easiest way. But also through 8 Weeks to Wellness, there's a contact form on there and they can just reach out through the contact and that'll come directly to me.
And I noticed you have a doctors in team training 2-day intensive workshop, Functional Wellness in Practice, coming up in November in Atlanta, Georgia, too.
We do. You're more than welcome to attend that. That's going to be November 8th and 9th in Atlanta. We do 2 days of functional medicine training. InBody is a really big part of that. But we go through everything: our day 1, day 2, how we do our wellness score, our weeks to wellness program, how we, basically from point A to point B, how we take somebody through the program, what are the 5 fundamental components, all of that.
Is that something that you run annually or biannually? If this episode, somebody sees it after November,
We generally do that twice a year in different locations.
Very good. Well, I hope you guys check that out. And if you're interested in getting an InBody and you want a special offer, we've got one connected here with Dr. Donahue at learn.inbodyusa.com/8WW. And you could connect there with our team. We'll make a special offer to you. And thank you again so much for your time, Dr. Donahue.
It was an absolute pleasure.